Good afternoon, and thank you for joining us once again today for our daily COVID-19 update. Today I am joined by the Medical Director, Mr. Krish Rawal. I will start by running through today's COVID statistics. As of this morning at 8 a.m, the total number of swabs taken so far was 2,711. There are 196 results pending, and the total results received to date is 2,515. We have a total of 2,273 negative test results, with 144 confirmed cases and 12 active cases, which is no change from yesterday. We now have 132 recovered cases. I will now share with you our hospital statistics. In the last 24 hours, there have been a total of 46 attendances to A&E, which is a marked increase in general attendances. Of these, 9 had symptoms that could be related to COVID-19. There was 1 admission to John Ward, which is our COVID ward, in the last 24 hours. There were no admissions to COVID CCU. As I announced last week at the press conference, a joint dry run involving both St Bernard's Hospital and the Nightingale facility took place this past Thursday. The exercise's scope was to test our recall of staff via our St Bernard's Hospital call centre in case of an emergency, to test the resilience of the ambulance service in a surge scenario, to determine the triage capacity by the senior nursing staff, and to assess St Bernard's Hospital's ability to decant patients to the Nightingale facility. The feedback is such that all the testing objectives were met by the exercise, and only minor issues regarding communication and coordination have been highlighted. These have since then been corrected. Our ability to carry out these exercises of this nature allows us to audit our practices in test scenarios to ensure that we are able to provide the best possible response should this be necessary. Once again, this dry run involved volunteers acting as make-believe patients, adding that most important element of realism to the scenarios. I would like to thank all those involved, and the feedback has been extremely positive. The GHA continues swabbing patients via our drive-through facility at Rook. So far, a total of 1,020 swabs have been taken via the drive-through facility, which continues being a very useful means to test the community and carry out the targeted testing program of frontline workers, including healthcare workers, the RGP, Borders and Coast Guards, Her Majesty's Prison and MOD staff in a safe and controlled environment. As of midday yesterday, a total of 536 swabs have been processed via our in-house laboratory testing equipment since we started on the 9th of April. Our on-site equipment allows a quick turnaround of test results when medically indicated and necessary. Last week, the GHA started temperature scanning at St Bernard's Hospital and enforcing hand sanitizing. This follows what has already been introduced at other GHA ERS facilities. The GHA is continuously researching into COVID-19, as is the Government of Gibraltar. COVID-19 is such a new disease caused by a strain of coronavirus that the research being carried out worldwide is critical to all of us if we are going to find a way to get over this pandemic, be it by way of any future vaccine, treatment, or change to the way in which we live. At the end of the day, the aim is to preserve life, and especially that of the most vulnerable. Nevertheless, one thing is for sure: COVID-19 has put things greatly into perspective for all of us. When medical research has seen our life expectancy increase over time with better treatments and better surgical advancements, all it takes is for something so small that we cannot even see under a microscope to all of a sudden reverse the trend of increased life expectancy at the blink of an eye. Now, all of a sudden, being over 70 is a risk factor in its own right, albeit when we have other associated compounding and unstable conditions. I must stress that for most healthy members of the community, that is, COVID-19 is a fleeting infection, one that will pass most of us by without much effect. But for some of us within the community, especially the vulnerable, it will test every part of our resilience to it. These are the very people we need to protect, and it is not until it affects someone close to us that the penny will drop. As a government and as a GHA, this is exactly what we're trying to protect the community from. There is a very fine line that needs to be found between slowly opening ourselves up for business and to be able to try to resume normality. But normality may have changed forever. We have to be sensible. We do not know this for certain, but already our lives have been disrupted in so many ways that were thought impossible 6 months ago. Today, some businesses have reopened, but in a different way. They need to provide hand sanitizers and face masks if they are unable to provide social distancing within. In Gibraltar, this was unheard of. This is how our lives have changed. It is hoped that things will return to how we recall them. History has shown epidemics and pandemics resolved over time with advances in medicine, so I am confident that over time we will too return to a way of being. But in the meantime, we have to be very careful and very conscious of where we are. If we do not need to go out, we should not go out. COVID-19 has taught us many things, and no doubt it will continue to teach us many more. Our history and our past is held by those we wish to protect the most now, our parents and our grandparents. As a society, we are so fond of our elder generations. This is a natural human trait and in fact an animal condition to look after our very own genes. So far, it has been relatively easy. The weather has been on our side. Since lockdown, there have been very few beautiful days that it has been simple to stay indoors. Now, as we look out slowly, we need to remember the basic rules: hand washing, keeping social distancing, and wearing masks if in close proximity with others or in enclosed areas. This advice will continue to change as we learn more about the virus and its spread. The Royal Gibraltar Police has had to intervene yesterday and close off some areas because of the numbers of people congregating in certain places. Eastern Beach was one clear example. I am sure that the Commissioner of Police, Ian McGrail, will have more to say about this tomorrow at the 4 p.m. press conference. The law sets out clearly that we are still in lockdown. We are only allowed to go outdoors to exercise, go to work, or shop at certain establishments. We will be slowly returning to a more normal life in terms of what we can do, but for the moment, going to the beach and sitting on a towel is not exercise. Driving to the beach, parking your car and sitting on the sand is not exercise. But driving there if absolutely necessary, or preferably walking or cycling there and perhaps taking a swim, and then walking, cycling or driving back is exercise. We need to be sensible, because the efforts of our actions today only manifest themselves in 10 to 14 days' time. It is very difficult to measure the effects and the consequences of our actions today. In 2 weeks' time, we could have a surge, but not necessarily so if we are sensible and take care. This is our aim. But we must not think for one moment that change is bad. On the contrary, some change is in fact very good. We could all do without wearing the masks, and we could all do with going out and do some shopping or go out for dinner, and that time will come. But there are things that we are doing now that are very positive indeed. I am so pleased to see more and more people walking and cycling. I see parents with their young children cycling on safer and quieter roads. I am pleased to see less cars on our roads. Our environment is improving, and this will improve our respiratory health. As a race, humans are getting heavier, becoming more overweight and suffering from poor health as a result, suffering more heart disease, high blood pressure, high cholesterol, diabetes, and all the things that come with being overweight and obese. This compounded with high levels of smoking and low levels of truly meaningful exercise in the community is the perfect recipe for ill health. Ill health leads to a greater need to see doctors, to take medicine, need treatment, and suffer serious diseases that would lead to a decrease in quality of our life. COVID-19 has taught us, and it is teaching us, to keep healthy, to keep fit, because by doing so, we have a better chance of surviving the pandemic unscathed. As we slowly look out, we will be looking at public health and medical experts to help lead the way. But we will also be looking further afield and also looking at how other cities are coping and changing to better and healthier futures. We will need to look how we move, how we travel, where we go on holiday in future. At the end of the day, our health rules everything we do. Without it, we cannot move, we cannot travel, we cannot love. Changing our lifestyle will make us a better, a fitter community, and the benefits will be huge. I'm excited for our future because I think that together we can make a difference to Gibraltar and indeed to our planet. I think that COVID-19 will make us stronger and healthier, and it will teach us to accept what we have. For now, the most important thing is our health and our families. What use are material things if at the end of the day a virus can take it all away from us overnight? Government is working hard as we prepare to lock out, to assess which of the measures we have taken as a result of COVID can remain, what things we can do better, and what things we were doing before that we can perhaps do away with completely. In this way, we can become a better place, one that attracts people to us, especially tourists, perhaps because we are a sensible society and a safe and greener place to visit. We are a remarkable community. We have beaten so many things in the past and stood up against adversity. We will do very well indeed if we set our minds to it. For now, however, our minds have to be on our vulnerable and on our frontline workers, especially those who we need to protect and will then need to be there for us should we need them. So our success is down to you, down to all of us. Let's not let the first rays of sun blind us. Let's not let the first shops to open distract our attention from the reality. There will be many days of sunshine ahead of us. There will be many days for shopping, for pleasure. Please be sensible. Let's keep safe, stay home, observe the rules, look after ourselves, keep fit, eat healthily, and let's keep smiling. Finally, although the Chief Minister has already mentioned this publicly, I would like to take the opportunity to thank and congratulate GBC for their effort and huge fundraising success at the GBC Open Day, Stay Home edition. Once again, the whole community stands united for that common cause. Before I hand over to Dr. Rawal, just like to mention that he will, among other things, talk about the GHA's plans to restart medical services over time, as we do have to understand that we have a hospital to run, other than COVID-19 to take care of. We are very aware of the needs of the community. We still have heart disease to prevent, to treat. We still have cancers to diagnose and treat, and knees and hips to replace. But I will now hand over to Dr. Krish Rawal. Thank you.
Minister, thank you very much. Good afternoon, everybody. I hope you're all safe and well. Today has been a very, very important day for our community, and I know that many of you watching have breathed perhaps just this little sigh of relief. This element of normality perhaps has returned to our lives on such a beautiful day. But I'm just here really to go through a few things, but also to remind you that we all continue to fight this virus. This is just the start of a long road, and we're learning about how it will affect us and change our perception of normality for the future. It's something that the Minister has already said. No matter how tempting it may be as we look outside at this beautiful sunny day, perhaps to believe that everything's back to normal, perhaps it was all a bad dream. But in actual fact, we do need to change our normality completely. Now, I will go over those some of those elements further on, but for now I've got some updates for you, perhaps some additional information and clarity on some of the things that Minister has said, and also talk about our GHA plan to restart our clinical work. So going on to the statistics that Minister has discussed, there has been a noticeable increase in the attendance in A&E. I'm wondering whether perhaps this could show some confidence of people returning back to the hospital. On average, over the last few weeks, there have been about 30 general attendances. That's not 30 attendances specifically for COVID, but general attendances in every 24 hours, plus or minus. But over the last 24 hours, we've seen an increase to 46. Maybe that's a one-off, or maybe there is a gradual increase in attendances. The actual number of those who are attending with COVID symptoms has stayed pretty well steady. So, of course, we are planning to bring people back into the hospital and start dealing with our waiting lists and encouraging people to come back. And of course, I will always ask you that if you have a medical issue, that you don't ignore it, that you do seek the proper medical attention, and that will, of course, at some times and some occasions include A&E. However, I would ask you all, please, just to think very, very hard before you come into A&E, before you come into the hospital and expose yourself potentially to a COVID infection, potentially to other hospital-acquired infections, and contact with other people who very well may be unwell themselves. So before you do come to A&E, please think hard about it. Remember, we have other avenues open to you now that we didn't have before the pandemic, such as telephone consultations with your GP and the 111 line, both of which have created an incredibly reliable and very high standard of service. Hospitals are risky places. We've said this on many occasions. We talk about COVID-19 as the only infection, but there are others, MRSA, which people have heard of, which is an antibiotic-resistant infection, and CRE, another one, and these are infections that we deal with all the time. So we would say to you, please just have a little thought before you just consider coming down to A&E. Talking of the statistics, when we go through our statistics, we talk about active cases and recovered cases. I know that some people are wondering what is the difference. When does somebody who's an active case become a recovered case? And by and large, if you want a generalization, that's usually about 14 days after your symptoms have started, or 14 days after your swab result if you've been asymptomatic. But of course that very much depends on clinical assessment, and it may be that some people recover sooner and some people may take a little bit longer. I know there are some people out there who have taken somewhat longer, some people who visited hospital on a number of occasions because they've not been feeling well after the expected 14 days. But actually this is a clinical judgment, and so sometimes you may see that those statistics from active to recovered don't change very quickly, and then suddenly there will be a change as people have been followed up on the telephone and people have recovered. So moving on now to the research, I'd like to give you all some research updates, and I keep track of many of the research papers that are being published. There is obviously a worldwide hunger for treatments and greater understanding of this virus. Lots of people are publishing studies. Some of these studies are very, very early on and not particularly reliable because the numbers of patients that they use for the studies are very small, and of course then you can't really make any conclusive judgments. But some of the ones that are coming out, for example in the UK, been lots of sensational media stories about 63% of NHS workers in the UK who are of an ethnic minority. Now, that is a story which in itself has hit the headlines, but of course with a lot of these things we've got to look much more closely into the story and into the background and what's happening, and there are lots of factors for this one. For example, in the NHS they say, particularly in London, that over 50% of workers in the NHS in London are of an ethnic minority, and many of those may very well live in overcrowded homes or multi-generational homes. We've talked about that before, homes with perhaps grandparents and young children, 2 or 3 generations at least. We've seen worrying pictures in the UK of lots of people ramming themselves onto the tube trains and onto the buses, where social distancing essentially seems a distant memory already, and so there's close contact in big cities. There's a possibility in the UK, or if you live in the north of the UK, where you may have some vitamin D deficiency if you don't get much sun. There are, of course, the underlying medical conditions that may very well be unstable, people carrying extra weight and people who are overweight and obese. And of course there are many people who work in the NHS, for example, who may be of an ethnic minority, who may be first generation, who've come from overseas. They may have unknown immunisation status. Do you remember some weeks ago, I know it seems a long time ago, we certainly encouraged everybody to get their flu vaccines to give you that little extra bit of protection. There are, of course, maybe that people are delaying symptoms. These NHS workers are working long and hard and are showing a great deal of dedication to the hospitals and the healthcare services that they're working in. They may very well have delayed seeking care. And of course there is a genetic element. Lots of people have talked about why one country experiences worse cases of COVID infection than others. So the reason, why am I telling you about this particular story, apart from the fact that lots of people are reading it and worrying about it? Really, it's because there are some simple lessons, I think, from that one. The Minister has already spoken about health and exercise, diet and lifestyle, and how we should look after each other. And of course, I agree that it's amazing to see so many people running, walking, cycling, quiet streets. I'm sure there are many people out there who've taken up running, and exercise anew during this time. And now, of course, is the time to try and have a think about keeping that up, especially if you're now going back to work. And suddenly now there's a time pressure on whether you can do that exercise, and I would absolutely encourage you to please make the time to carry on. You've done the hard work, keep it up, please. The other simple lessons, we talked about predispositions, perhaps. Obesity. There's a study which has been published with 214 people in, so it's a reasonable sized study, which has shown a 6-fold increase in severe COVID illness in those who are extremely overweight or obese. Vitamin D ties into exercise and health, and medical conditions such as blood pressure, obesity, type 2 diabetes. For example, a study in New York showed 5,700 hospitalized patients had these things in common, particularly medical conditions which were unstable. And of course, many of these conditions are preventable medical conditions, and that already ties back into looking after your health, exercise, diet. And the government, of course, have been very clear on the messages of social distancing. Social distancing, especially for those over 70 who are in lockdown still, perhaps people who are in the same household, and of course public transport. I know there have been lots of questions as to why we are starting businesses and shops again, but why public transport hasn't started up. And of course the message from the government has been very clear, and the message from the government is absolutely wise and can be trusted, that we are considering public transport, but at this point we are not restarting something which may encourage people to breach the social distancing rules. So do we go back to relying on our cars, or can we now walk to work? Can we cycle to work? Can we do some exercise as we're going to work? And I have to say, from a personal perspective, I cycle to work, and there are many days at the end of a very long day when I would give anything to find my moped parked outside the hospital to go home. But it does me good, and the streets are quiet and safe, and this is a good time to encourage that. So moving on a little bit more with the research, you may recall some weeks ago there was some evidence about unstable medical conditions, and particularly blood pressure, and whether there was a link with some blood pressure medications. The studies have moved on from then, and I know there are many people out there who take a number of different blood pressure medications, particularly something called ACE inhibitors. You may recognize those as something called enalapril, ramipril, or perindopril, and also these other medications called ARBs. You may recognize them as losartan, valsartan, candesartan medications. And in actual fact, the evidence now is showing that these are not related with severe COVID infections. And in fact, ironically, the other way around, the evidence has shown the other way around. If you stop them, and there have been some cases in a number of countries where they were stopped because people listened to this early evidence. If you stop them, you end up having a stable blood pressure condition, which then becomes unstable, and that may cause harm. So for those of you who may have read something about this in the news, in the social media, and studies about this one, and you are some of those people taking those medications, please do not worry. The evidence actually is showing that you should stay on them and that you are safe to take them. Moving on a little bit, some other things, some other questions that people have been asking me particularly. You've seen in the UK some phrases about something called shielding, and somebody's asked, what actually is shielding? Well, in actual fact, shielding is something that we're doing already. Shielding is something which is essentially a name to some of the practices that we've been doing in our measures already. We've identified those at most severe disease risk. Those are people with cancers, for example, severe and unstable medical conditions, such as severe asthma. And I'm using these words very specifically because there are lots of people with asthma, but if it's stable and you're taking your medication and you're looking after yourself, then that doesn't give you an increased risk. So severe asthma, severe COPD, immunosuppression treatments, these type of medical conditions. Shielding is just a term which says do not leave your house, don't go to any gatherings, avoid anyone with symptoms. This is nothing new, but I'm just giving you an explanation in case you start reading in the media about this particular phrase. But we've been doing this here for weeks. So the other questions that I've been given, somebody asked me the question about how can I pass on the virus? What is the issue with the transmission of the virus if I've already had the infection and I am immune? So the answer to that is if you've had the infection, and Director of Public Health has already said that immunity is not necessarily guaranteed, and if it is, then it may not last for very long. Maybe it will last for 6, 9, 12 months, something like that. But if you do have some resistance or immunity to this virus now, You wouldn't be passing this virus on to somebody else by getting the infection again and passing it on to somebody else like that. But equally, you may very well pick this up. You might contact something that has the virus on it, maybe on your hand, maybe you'll touch some other object, or maybe you'll touch some other person. It'd be almost like passing the baton. So the idea really is that if you've had this infection, please do not think that you are superhuman now, that you're resistant to everything. Please remember that you have to stick to the rules of social distancing, washing your hands, looking after yourself, even if you've had this infection, because we are trying to protect others as well. And then the final one, perhaps, in terms of some of the media stories, is about this 2-meter social distancing. There are lots of pictures on social media, on Facebook in particular today, about Main Street. Some of which are absolutely not reliable pictures. Some of which, taken at the top of Main Street, may give the impression that Main Street is very crowded. So now, and we've always said that if you're going to go to the shops now, stick to the rules, stick to the social distancing, use the sanitizing hand gel, wash your hands, and don't touch your face or your mouth. It's about common sense. Chief Minister has said this. But how do you know what is a 2-meter safe social distance? It's a very difficult thing when you walk down Main Street and people are walking around you. How do you assess what is 2 meters without walking around with a tape measure? The best way to do this is for an adult to stretch your arm out and do the same for the person that you're nearest, but don't touch, and you will find if you do that without touching your fingertips, 2 of you, you will be about 2 meters apart. And that is the best way to give you a measure. Now, that may be very, very difficult when you're walking in a crowded place or somewhere that seems crowded, when there are other people moving around and you can't predict exactly how they're moving. So this is where the phrase about common sense comes in. And it may be that instead of thinking it as common sense, think of it as trusting your instinct. If you go to an area, to a park, if you go to a beach, if you go to Main Street or to a shop where there seem to be lots of people, and your instinct tells you that this is not a place to be, then trust your instinct. I certainly saw a comment on Facebook earlier where somebody said that they found going into a crowded area very worrying. And my answer to that would be, then, if you were worried about it, then perhaps you should have thought twice about going. I know that sounds like a slightly harsh statement, but think about what you're doing. If you're worried, trust that instinct. And I'm sure, unless it's vital, I'm sure that you could come back another day. Your health is absolutely paramount. So now, moving on really to our restarting of our clinical activity, the GHA is absolutely considering now and planning for restarting our clinical activity. And we are working in phases here, very much the same as Chief Minister's announcements about unlocking the rock. So what we're going to do is we're going to start with phone calls, and in actual fact, in many specialties, they're doing this already, where we will phone patients who are on waiting lists, and we will ask you whether you're still waiting, which might actually seem like a strange question, seeing as you've been on a waiting list for a number of months and in many cases worrying whether you've been forgotten. But there are many medical conditions which, even after referral, may get better. Sometimes in the lockdown, the rest is the thing that's caused a resolution of your symptoms. If you've taken up a new exercise or a stretching regime, maybe that's resolved a musculoskeletal problem, for example. So time as well can heal things. So the first question will be, are you on the waiting list still in terms of needing to be seen? And what we will do then is we'll make some decisions on priority, how long you've been waiting for, but also how severe your symptoms are. And then we can assess everybody on that waiting list to see who needs to come in first. Secondly, we're going to actually carry out, for anybody who we do wish to bring back into hospital, particularly for an intervention, whether that's a surgery or an investigation, we're going to do some risk assessment scoring. So the idea behind that being a scoring tool that we'll use to make sure that we don't invite you into the hospital and place you at an increased risk of COVID infection, or in fact MRSA or CRE, or for any infection for that matter, and whether we can actually do this, whether we can provide you care another way. We've done so many new things and changed the way that we practice, and perhaps there are ways that we are doing with telephone consultations and face-to-face consultations on a video link that may be a more effective way to do it, and that we can deliver the same level of care. For those of you who are invited in for surgery, we will do a pre-assessment screening, and 48 hours before you have your surgery, We will take a swab to make sure that you don't have a COVID infection. And for some surgical cases, we may very well ask you to self-isolate for up to 14 days before your planned surgical procedure. Now, I know that sounds like an incredibly long time, and that's going to be a difficult ask for many people, particularly if you're working. But actually, the evidence at the moment shows that between 25 and 50% of those who have surgery and then catch a COVID infection come to very, very severe harm afterwards in the post-operative period. So this is not taken lightly to ask you to self-isolate. And absolutely, the first thing we must take into consideration is your health and your care, and that we are providing the right thing and not placing you at increased risk. Part of our restart will also include screening services, and we will start with those who need a follow-up. So those who've had screening services such as a mammogram, for example, cervical screening, the aortic aneurysm screening, who have actually had a follow-up which needs to be done sooner than the planned 2 or 3 yearly investigations, and we'll start with some of those first. And then after that, we'll also increase some screening for bowel cancer, for example, for those who have found recently to have positive stool sample results. And then after we've started dealing with those, we will start recalling people for routine screening again. In these early days, Chief Minister has said that we're going to do these increments in every 3 weeks. And in these early days, we will start very, very slowly, very, very gently. And the initial clinical services will start with the ability to turn off in 24 hours if we suddenly see a spike. But we are fully intending to have a phased increase. So over time, you will get contacted from the GHA, from the relevant specialty. I would also say, though, that each clinical specialty may very well do things slightly differently. So this is a generalization depending on whose care you are under. So from my final thoughts, really, the first thing to say is a very, very big thank you to Hermione Hogg, who sent me a wonderful rainbow card. Thank you very much for thinking of me. And then really, just to go back to what I've said a little bit about common sense and translate that common sense into trust your instinct. Enjoy the peace that we are at the moment. I know this has been a very difficult time for people with the lockdown, but perhaps let's see whether we can keep this going a little bit, whether we can take our new normality forward. Enjoy the clean, fresh air. It's not actually by coincidence that that everything looks greener, that you can see clearer across to Spain and Morocco. It's because the air pollution levels have reduced. Perhaps we should look at things with a little bit of a different perspective now. So can we continue this? Yes, we can. Slowly we can lift things. And I certainly don't want to go back to a state of lockdown, and I'm sure neither of any of you do either. So please, please, I would ask you, please don't be impatient. I know today was an important and special day, but please don't be impatient. A few more weeks, we're going slowly, and we will take things very, very gently, step by step. In the meantime, I'll ask you to take good care of yourselves, be strong, and don't lose your focus or resolve just yet, although I'm sure it's very, very tempting now. And just remember, as the final messages, the simple messages, even today in a time of very, very incredible technology, modern medicines that seem to have a cure for absolutely everything, it's the simple things that will keep us safe. It's the simple things which have won through so far. Washing our hands, catch it, bin it, kill it, keeping well, looking after yourselves and each other, perhaps slowing down and changing our focus a little bit. And if you do need us, call 111 for COVID-related medical matters. Call 200-41818 for all other COVID-related queries, 2000-7910 for GP consultations. Thank you.
I'm just wondering if you're concerned by some of the scenes we've seen in Main Street today. Do you think that people have misunderstood the purpose behind this relief measure, and are there any plans to tweak it at all?
Right, as Dr. Awad has mentioned already, it's the first day, and some of the pictures, the angles they come in, give the impression that Main Street was full. We need to really fully assess, whether this is correct or not. This is a very fluid thing that we're doing. Obviously, if I use the analogy of the tap, we've had a constant flow rate through that tap. We've been going out to exercise our pets, we've been going to the supermarket, we've been going to work, and we've been exercising, and that has led to a certain amount of infection within the community. As we now need, we definitely now need to start thinking of opening that tap further. And as you open that tap further, obviously the initial flow of water is, the excitement that people for a long time have noticed that shops have opened, and obviously people will go out, and we're pretty confident that will just ebb down, and the flow will come back to a more steady flow, which is what we want. But our eyes are there. We're looking at it very carefully. The RGP are our eyes on the street, and we will obviously assess. And if we see that this practice develops, there's more people on the road instead of less. If people aren't observing the laws and the rules of that we've imposed in terms of social distancing, etc., then we will need to reconsider and see what we do. But this is just the first day, and we expect that come next week, things will be more normal, and people will reinforce the messages constantly to make sure that people remember that they can go out to do a bit of shopping, but more than anything else for essential items, and as long as they remember the simple rules that will keep us safe. If we forget those rules, if we start going out together in mass, then we need to reconsider our position.
Okay. Yeah, about the shopping. I mean, is it okay for people to go out window shopping per se? I mean, like if you go to a shop, you rarely, probably a certain percentage of that time, you actually go out just to see these products. I mean, is that possible? And if so, could this lead to a greater influx of people onto Main Street in order to carry out this window shopping to see what they like? And is this actually really helpful for the social distancing criteria?
We need to be very clear, and the purpose of what's happened now, this is not for people to go window shopping and go around seeing what they like to buy. This is not the reason behind this. This is to be able to try to make shops start working slowly, and allowing people to go out there and buying things which are still essential, things that they may need. They may need some clothes. They may have gained a bit of weight, hopefully. I mean, not something very positive. They may have lost weight because because more people are exercising more. They may need to buy certain items. That's the purpose of this. This is to go out and buy essentials. What used to be essentials for life, which was going to the supermarket and buying food and water, and now it's been extended a little bit more to allow people to go have that freedom to see what's out there. But remember, we are still in lockdown. The point is that we don't go out, just to see what's out there and see whether we can meet people and see what's going on, or curiosity, or window shopping. So that's not the purpose of what we're doing. We must be very clear and that we are still in lockdown. We have to obey all the rules set, and remember, this is set out in law.
A question from the Panorama. As the Minister and Medical Director, are you not concerned about the consequences that could flow from virus carriers entering Gibraltar from a high-risk area as is Spain, and are you satisfied with the measures in force at the frontier?
Well, at the moment, as I gave the analogy of the flow rate, I mean, we are receiving workers on a daily basis into Gibraltar anyway. Many of our key workers live across the frontier, and that leads to X amount of infection. As we start opening our businesses, which is important, we can't remain in lockdown for the rest of our lives, we will see an increase in the amount of workers coming through the frontier. So there is a little bit of increased risk. That is normal. That's something we have to live with. But it's finding the right balance, so we can return a certain amount to normality. Once again, and we do depend on people coming across the frontier. So that is inevitable.
Yeah. And if I may, really, I know that this is one of probably the most original messages when we started these press conferences. It was never about preventing the virus itself, because we can't. It's all about flattening the curve. It's funny how that phrase now seems to have kind of gone into the past a little bit, but it is absolutely about flattening the curve. So this very, very gradual increase in introduction in people coming across the border will, of course, bring people who are asymptomatic, who don't know they have the virus, who may therefore increase the risk of infections for people within Gibraltar, or the other way around, potentially. But we, from a medical perspective, we are ready for that. We've always been ready for that. And the idea being that as long as we can cope with this, we can provide the right supportive treatment for people, we have to allow a very, very gradual release at some point. We've got to.
And the next question is from YGTV for Minister Valvan. The RGP's Assistant Commissioner, Richard Alger, tweeted a picture earlier today of a busy Main Street. Mr. Alger wrote that this was not meant to happen today and the situation was not helping officers or helping to save lives. Is the government similarly disappointed that common sense has not prevailed, and will it reconsider its decision to reopen shops?
No, what we need to be sure of that we need to give that message out. What's happened today, as I said, the tap has been opened a little bit further, and people have taken that opportunity to go out and do a bit of shopping. Some people have gone out for that, for maybe for to have some hair appointments or some things which some people consider necessary. I think common sense must prevail. I mean, if everybody goes out to window shop or to have a haircut, or they start accumulating around the shop entrances, talking and chatting, then obviously that is not using common sense, and that makes the work of the Royal Gibraltar Police extremely difficult. So what we're trying to do, we need to work together on this one. I think we've done extremely well. We need to make sure that we're protecting ourselves, but also protecting our vulnerable. Going out should be, if you're going to go to hairdressers or for an appointment of any type, it must be via an appointment. You can't just go there to see whether you can fit into a slot. That's not the point. But it is important that we measure. We will keep our eyes on Main Street. We will see how things progress, because obviously everything has repercussions.
GBC asks, Minister Valvan, you talk of fast turnaround for in-house results. How many days is the fast turnaround? We have received information that people tested on Tuesday are yet to be told results.
Okay, there are different methods of testing a swab result. Our fast turnaround carried out within St Bernard's Hospital is a matter of hours, and the Dr. will confirm that if necessary. Within hours, we have a result. Now, we're using these tests when it's clinically essential to use them. If there are other methods, there are other labs in Spain that we use, and they will take longer. So it very much depends what the purpose of these results are for. If it's because somebody needs a treatment, if it's because somebody who may have suffered a heart attack or whatever needs to go to get treatment in Spain, then it is critical that we have a result immediately, and those results are done internally, and the results are there within hours. If it's something that is not so urgent that we need, if we're doing a trial or we're doing some screening, and we can allow, if the results aren't critical, then we can use our sources in Spain, which gives us other avenues and other options.
Just really to add, of course, we've said this before, that we are testing. We're using this thing called PCR testing, which is a way of processing the swabs, which every other country is doing the same thing. So those suppliers that provide the swabs, the reagents, the machines, all of these things are in high demand because everybody's doing the same thing. So we have done very well in anticipating the need for the necessary equipment, the necessary reagents, chemicals and swabs, so we can do our in-house testing. But really the idea behind that is not to then simply use all of that up simply to get a result which perhaps doesn't really change the outcome over the space of 1 or 2 days. Minister is absolutely right. We can test within hours if we need to. We would rather use those for the patients and the people who clinically need it, and also to keep a reserve in case we have a surge.
Are there plans to scale back your presence at the Nightingale facility?
Well, the Nightingale facility is we've scaled back a little bit in terms of the number of staff who are there. We have staff within the hospital who have been working for every single day for weeks and weeks and weeks, and even that resilience needs some rest. So what we've done is we've redeployed and moved staff around, and some of the staff who are up at the Nightingale we've moved down into the hospital. That also keeps them current and gets them integrated with the teams and ready to go if we have a surgeon, if we need to use the Nightingale facility. But it's a very much a dynamic thing. It's certainly not a case at this point where we would anticipate just closing the doors and mothballing the thing and just saying, well, we don't need it. We absolutely do need it at the moment. It needs to be there for us. It's part of our healthcare provision. It's part of our assurance. It's part of our preparedness. But certainly we are being wise with the resource where we can.
Krish, I just wanted to know, can you tell me a bit more about the people who were interned into the CCU, the COVID CCU, yesterday, was it, or the day before? And moreover, if they were part of the random sample, or if the random sample itself has been processed?
Okay, so there are actually two elements to that. Firstly, let's deal with the second one, which is the random sample, or the random sample, if you recall, was some weeks ago in actual fact where we tested...
No, the frontline random sample.
Yes,
yeah?
sorry, yes. So the random sample was the 400 that we did some weeks
Yeah.
ago. Then we're doing what we would call a targeted sampling. I know it seems like semantics in terms of the wording, but now we are choosing specifically frontline workers, and that's not just healthcare workers, that's frontline workers across the emergency services and anywhere where there's essentially people-facing services, and we are doing sampling across there as well. So that's one side of it. Those people that we are by definition sampling within that targeted sampling we're really looking for those who are asymptomatic, who have no symptoms. And so, as a result, they are not the people who would then, by definition, come into hospital, whether that would be to our COVID wards, whether to our non-COVID wards, or to our intensive care wards. In terms of the first part of your question and the people who came into intensive care, clearly for medical confidentiality, I can't give you any specific details, but what I can say is that the COVID intensive care unit has a number of different purposes. Clearly, if somebody came in very, very sick with a COVID infection, that is what it is there for. But we have had some patients who have been over to a specialist centre in Spain who have then come back to require a higher level of nursing or medical care within an intensive care unit, and by default we will put them into that COVID ward, that COVID intensive care first, until we are satisfied that they have a negative swab, and then after that point that we will then put them into the non-COVID, I suppose you could call them the clean areas. So those are the main reasons why. Anybody where we have a suspicion, some people might come in with a heart condition or a very, very severe breathing condition where the clinical assessment is that this is not COVID, but we can't 100% guarantee it. It's safer and better for the hospital generally if we try and keep somebody until such time as we're satisfied they don't have the infection, keep them in a specific place, keep them nursed and cared for in an area where infection can't transmit, make sure that we can't move them into a ward where we would contaminate somebody else or somewhere else.
And as a follow-up to that question, do you have any other results from the targeted sample you mentioned?
Well, there's a number of the results that Deputy Chief gave yesterday. So far, we've gone through, and Minister Balban has also mentioned it, we've been through the MOD, we've been through RGP, we've been looking through elderly residential services in terms of their staff as well. I think by and large we've not picked up infections from there. I think I can't give the specifics, I will give you the specifics if I look into it, but by and large so far we've had very good results.
A reader has sent Panorama the following question. Whether you live in a block of flats or anywhere else and you have your car in a garage or parking space, if you go for a drive and return to your parking space without having alighted from your car, does this mean that you cannot catch the virus? Hence, is this practice allowed?
The truth is that you can catch the virus. The virus can be in a lift button. It could be, any surface that you touch. And just simply by driving around, it increases the risk of accidents if everyone were to adopt the attitude of I will drive around. Not only that, but cars need fuel. You need to go into the petrol stations. You need to refuel. You need to touch the petrol pumps. You need to then pay. And you may pick up, the old pack of sweets while you're there. So the virus could, in theory, be everywhere. So it's not a correct statement to make. Other than that, it is against the law to get a car and just drive for the sake of it. Remember, what needs to be done is if you need to go out for anything essential, then you can take a car. For example, if you need to go shopping, so you can bring your food and your items back. If you need to go to work, and it's the only way you can get there, then you can use your car. But the RGP have been policing Gibraltar and very, very well, and stopping vehicles at many different roundabouts to actually asking people where it is that they're going, because just use of a car, just to drive around Gibraltar just for the sake of it, as that's not something which is recommended or we want to see. And in fact, it is not allowed in that respect. And furthermore, all it does is contribute to pollution, something which we are so much cleaner now, and the environment we can notice a remarkable difference in that respect.
The next question is from YGTV for Dr. Rawal. We have been in touch with someone whose partner was diagnosed with COVID-19 who who has received 3 different and conflicting bits of advice from doctors. The family have been told to isolate together at home by one doctor. Another doctor said they could go out as long as they were not showing symptoms, and another said that they can go out but only wearing masks. Could you please clarify what the correct procedure is and explain why this confusing advice is being given?
Okay, so let's deal with the confusing advice, and I'm sure there are many people out there who've over the weeks found that the advice has changed as time has gone on, and we've always said that this is a new virus for us, and that as things progress, we do gain a greater understanding, and public health advice, of course, changes, which is the right thing really, because medical and public health advice, of course, has to react to what's happening. And in my statements, I always speak about the research. Research changes. Even today, I spoke about a particular piece of research which 6, 7, 8 weeks ago gave one conclusion and now gives another. So, of course, there have been what perhaps you could call conflicting advice. It of course, has never been deliberate, and I'm always very sorry if somebody has felt confused by that. That's never really been the case. It's just that things have moved so quickly that advice has really changed. In terms of this specific case, I would say that there are different countries doing different things. So that, of course, gives you conflicting advice once again. The UK have talked very clearly about if one person in a family, then to lock down the whole family, for example. There are other countries that say just the person who has the established infection, because it's not guaranteed at that point that the members of the family may get it. And of course, somebody may be a frontline worker or a vital worker, or may need to go to work, or may need to leave the house. I think the best thing to say is that we have shown that our advice has always been consistent and has always stood us in good stead. That we will treat every single case clinically. We will make a clinical assessment on the person concerned. If somebody develops symptoms and they call 111 and they are swabbed and they're given a positive result, they will be asked to self-isolate. Now, if they're in a household with a family, that family does not need to go into lockdown unless they develop symptoms themselves. But we will, and we are now going into a greater surveillance when it comes to contact tracing. So some perhaps of that change in the advice is also coming because we are now going into the Director of Public Health's stance of this seek and destroy. So we're going more aggressively into contact tracing. If somebody is in a household, we will actually now contact the family, find out if there are any symptoms, or if anybody's even a little bit unwell that perhaps they're ignoring. But for the moment, until the advice changes, the advice will always go on a clinical assessment.
The last question is from GBC. Has the GHA taken note of the South Korean research which says people can't relapse after recovery? And what are Dr. Rawal's thoughts?
Well, I've certainly read the article about that, and they're basically saying that if you've got it, you've got some immunity, and that there's no relapse. And of course, actually, I'd love to believe it, but as I've said very, very clearly in all of my press conferences, we have to be very careful with the research, with the statements that we read in the media, on social media, and unless it's a properly published peer review article. I think every single piece of advancement, of research, of evidence, or whatever those things, I think we should all take them with a little pinch of salt. We should all read into them that everybody's desperate to know a greater understanding. Everybody's clearly desperate to find that magic and to give us all a little bit of reassurance. The honest truth is I don't know. What I do know is that what we are doing is the right way, and doing everything very, very slowly, watching what's happened, learning as we're going along, prepared to come back again if we have to, looking after ourselves, looking after each other. Clearly, the things that have worked are the simple things. It may very well be that is the truth, that you can't get it again and that you're immune to it. Wouldn't that be fantastic? And certainly there are a number of companies out there producing blood tests which can show some level of immunity, and we are certainly looking into getting some blood tests that we can do that in the future and test the kind of population immunity, albeit that that's a logistically very difficult thing, and we are looking into that as well. So the answer is, please just read any of these kind of articles just with a little pinch of salt. Just watch how they go. Don't get too carried away thinking, well, that's it. It doesn't matter anymore. It all was a bit of a bad dream. What we are doing is the right thing. The way we are doing it is the right thing. Very, very, very slowly, very gently, and let's see how we go.
You know, we are reading and soaking up hundreds of these different articles from all sources, and all of a sudden you hear something which seems very positive, and then within hours you get the equal and opposite article. So again, it's extremely confusing. But we are reading everything. The government, you know, all the medical team, and we're very, very aware of what's happening around an area. But we have to be very careful with the advice. So just to finish off, then I'd like to remind everyone and just give it those few final words, which is please keep safe, stay at home. Please remember to wash your hands very, very frequently. Please remember the rules of social distancing. Eat healthily, exercise, and be sensible. Catch it, bin it, and kill it. Thank you very much, and good afternoon.